Okay, so we'll be talking about some two syndromes. I think these syndromes are actually linked to the adrenal gland. You understand? So I think some people might be confused on the concept of Conn's syndrome and Cushing syndrome. All right, so let's just break it down so you guys can get to understand better. So for Conn syndrome and Cushing syndrome, we'll talk about Conn syndrome. After we're done, we'll talk about Cushing syndrome. All right. So Conn syndrome is also known as what? Primary aldosteronism. I think when we talk about one here, we talk about let's talk about one first. Alright. So the hormone involved is what? Aldosterone, while in Cushing syndrome is cortisol. Alright. So this is Conn's syndrome. However, I could see that they're having almost the same presentation, but Conn's is kind of like different, having thin legs. Alright. So primary cause, the condition arises from what? An adrenoma, what? Adrenal adenoma, that's what aldosterone producing adrenal adenomas. So it's benign tumor or sometimes it's what? Adrenal hyperplasia. Increase in the number of cells of what? Adrenal gland. So it will actually lead to what? Excess production of aldosterone. Symptoms is high blood pressure, low potassium levels as hypokalemia. Please, you should note this. These are where the difference comes from. There's muscle cramp and weakness. Treatments include if it's an adrenal adenoma, surgically remove it. Then medications like what? Mineralocorticoid receptor antagonists like what? Spironolactone, Plerenol. Okay. Now, Cushing syndrome is what? The hormone, first of all, is cortisol. Excess cortisol production, which can be due to what? Long-term use of corticosteroid medications or a tumor that secretes what? Adrenocorticotropic hormone. Okay. So one of the characteristics of Cushing syndrome, the most popular one, is you having a moon shape, moon faces. Okay. So there's thinning skin that bruises easily. There's high blood pressure. There's muscle weakness. There's osteoporosis. So the mineral composition of your bone is kind of reducing. There's high blood pressure, high blood sugar. Sorry. Uh, can you see the difference? Okay. Yes, high blood pressure is in two, but this one is muscle weakness. Why this one is what? Muscle cramps plus weakness. So it's quite different, right? So management of treatment is what? A reduction of what? Reduction of the corticosteroids that you are using, or surgical removal of any tumor that is causing that. And also medications decrease what? Cortisol levels in the body. All right. So this is it, guys.